You know, we all have that medicine cabinet at home. We trust the things in there to help us, right? But what if a hidden risk was building up, one pill at a time, without us even realizing it? Today, we're going to pull back the curtain on something called anticholinergic burden. It sounds complicated, but trust me, it's something we all need to understand.
And that's a really serious question that researchers are digging into. We're talking about super common drugs, for things like allergies, depression, even bladder control. The problem isn't that any one of these drugs is bad. The real concern is what happens when their effects start stacking up, especially for older adults.
Okay, so what is this anticholinergic burden? Well, deep in your brain, you have this amazing messenger chemical called acetylcholine. It helps with memory, learning, muscle control, a whole bunch of important stuff. Now, certain drugs work by blocking that messenger. The burden isn't from one pill, it's the grand total, the cumulative effect of all the medications you take that have this blocking property. Imagine it's like a scale. Every pill adds a little bit of weight, and if you add too many, that scale can tip over, and that's when you start to see real problems.
And get this is not some rare fringe issue. Some studies suggest that anywhere from 20 to as high as 50% of older adults are prescribed at least one of these types of medications. I mean, that is a staggering number. It means this is a potential issue for millions of people right now.
And this is where it gets really serious. We're not just talking about minor side effects like a dry mouth. A high anticholinergic burden is linked to some of the biggest fears we have about aging. A much higher risk of falls, a noticeable decline in physical ability, scary episodes of sudden confusion known as delirium, and a real, measurable drop in cognitive skills, maybe even raising the risk for dementia.
Okay, so if this burden is so risky, you'd think the first step would be easy, right? Just measure it. Well, that's exactly where things started to get really, really complicated. Researchers knew they needed a tool to figure out a person's total risk, so they got to work. To try and get a handle on this, experts came up with these rating systems, these scales. And the idea, on paper, was pretty brilliant. You gave each drug a score based on how strong its blocking effect is, say 0 for none, up to 3 for high risk. Then you just add up the scores for all of a patient's medications, and bingo, you've got their total burden. Seemed like a simple, elegant solution. But it wasn't. And this is where it all starts to fall apart. Take a really common drug like quetiapine. One major rating scale says it's high risk. Okay, but then another equally valid scale calls it moderate risk. And a third one says, nope, it's low risk. So which one is it? You can see how this creates a total maze for doctors who are just trying to do the right thing and figure out a patient's actual risk.
So let's follow the logic here. Even with all the confusion about how to measure it, the basic idea still seems solid, right? If taking too many of these drugs is the problem, then the solution has to be, well, taking fewer of them. This simple idea led to a huge new focus on something called deprescribing.
And let's be really clear about this. Deprescribing is not about you just deciding to stop taking your pills one day. No way. It's a careful, planned, supervised process that you do with your doctor or pharmacist. It's all about methodically looking at everything a person is taking, figuring out which meds might be doing more harm than good, and then safely, slowly reducing or stopping them. I mean, this seemed like a total slam dunk. The logic was perfect. So scientists all over the world set up these really rigorous studies. They found older adults who had a high anticholinergic burden, and then they had expert teams of pharmacists and doctors work with them to carefully deprescribe the problem medications. Everyone was expecting to see some pretty amazing, clear improvements. So everyone was watching. The idea was solid, the studies were well designed, and the potential payoff for patients was huge. But when all the results were gathered together and analyzed, the answer was, well, not what anybody thought it was going to be. The big question, right? Did this super logical, common sense approach of reducing the drug burden actually lead to fewer falls, less confusion, and better brain function? Did it work?
In 2023, this massive study came out. What they did was they took all the best, most reliable clinical trials on this topic and pooled all their results together to get one big, powerful answer. And that answer was a genuine shock.
It turns out there was no clear, significant impact. The interventions didn't consistently reduce falls, they didn't really improve cognition or a person's quality of life, and what's wild is, in many of the studies, they couldn't even successfully lower the anticholinergic burden score itself. The obvious fix? Well, it turned out not to be so simple after all.
So what on earth happened? Well, it turns out that doing this in the real world is incredibly tricky. For one, a lot of the studies were too short to see long-term benefits, and often doctors and pharmacists didn't have the specific training or support they needed to do it effectively. And, sometimes patients themselves are hesitant to stop a medication that a trusted doctor gave them years ago. It's just complicated.
Now you might hear all that and think, well, that's a bummer. But actually, this is an incredibly important lesson. What it tells us is that simply trying to deprescribe isn't the magic bullet. The real path forward isn't a one-size-fits-all solution, but a much smarter, more personalized approach for every single person.
So the key takeaway from all this research, the thing you really need to remember, is that the focus has to shift. The goal isn't just to lower some score on a chart. It's about having a real, collaborative conversation, you, your family, your doctor, to weigh the very personal risks versus the very personal benefits of every single thing in that medicine cabinet. So what does a smart medication conversation actually sound like? Well, it really boils down to a few key principles. First, always ask about non-drug options first. Second, if a medicine is necessary, it should be the lowest possible dose for the shortest possible time. Third, you've got to review everything regularly, and that includes over-the-counter stuff and supplements. And finally, you always have to be weighing the benefit of that one pill against the cumulative risk of everything you're taking together. And here's the really hopeful part of this whole story. Things like falls and confusion have a lot of different causes. But as these top researchers point out, of all the things that contribute to these problems, drugs are the ones we can most easily change. They are the most reversible part of the entire puzzle. So while the science shows us there's no easy fix, it also screams for us to be more vigilant and to talk more. So take a look at your medicine cabinet, or the medicine cabinet of someone you love. Is it time to ask your doctor or pharmacist to take a fresh look? Seriously, it might just be the most important question you ask for your health this year.